we might be working on your flexibility. We might be working on your strength. Everybody needs core, especially tripods. They need core work all the time.
Why is canine rehab so important, especially during amputation recovery? What treatments are the best for tripods, and how do you find a good therapist? Dr. Ana Esqivel helps us explain on this episode of Tripawd Talk Radio.
Man scratching like a three-legged dog.
For any tripod, cat or dog.
Why do some vets do things that way?
So many people don't realize that their dogs are in pain.
He's a three-legged dog and he's still pretty good.
Hello, and thank you for tuning in to Tripawd Talk Radio. This is episode number 117. We're excited to discuss one of our favorite topics, rehab therapy for three-legged pets. And we've got an expert with us to help us explain the benefits. Dr. Ana Esqivel is a practicing veterinarian who recognized her geriatric patients were in need of special attention beyond the typical drug therapy prescribed for their pain management. She studied medical acupuncture and became a certified canine rehabilitation therapist. She now operates ACE of Paws, the only dedicated canine rehab clinic in Albequerque, New Mexico. And 3 of her patients have been recipients of our Tripawds Rehab grant, which will reimburse anyone who takes their three-legged dog or cat for rehab evaluation by a certified therapist. Thank you for joining us, Doctor, and welcome to Tripawd Talk.
I'm glad to be here.
Hi, Dr. Esquivel. We're so excited to talk to you. We haven't done a show on rehab therapy in a while, so it's exciting to have you with us because we are passionate advocates for tripods.
And our followers are as well, because ACE of Paws has seen 3 of our rehab grant recipients.
Yay! That's awesome.
Dr. Esquivel, can you tell me how you got into rehab therapy?
Absolutely. So my journey with rehab started back in 2017. So my own dog had lots of orthopedic issues. And after she had her 3rd knee surgery, I was just having a lot of trouble getting her back to, just being active, and was still having lameness issues, and she just wasn't recovering as well as she had the prior to surgeries. And so I reached out to a fellow veterinarian who was doing a little bit of rehab inside of a ER. And, she's kind of doing it more part-time, and she had a underwater treadmill. And I was like, my dog needs an underwater treadmill. Like she needs this to help her get back in shape. And after talking to her, she is actually a certified rehab therapist, but has taken time off and come back, and she's still around, but not seeing patients as a regular clinician. And so I was talking to her, and I was just like, how do I get into this? This seems really interesting to me. Like, obviously my dog needs this, and how do I get my dog a treadmill? And how do I learn how to do this right? And so after talking to her a little bit, she's like, oh yeah, she did the University of Tennessee program. And I started looking around, and I found Canine Rehab Institute, and they were a lot closer and a lot more of a hands-on type program. And so I really liked their program, and it was in Colorado, which is where I had gone to school. And so, some of the professors are affiliated with CSU as well. So I was just like, I'm going to check this out. And I started the certification in 2017, and then it took about a year or so, because it's you go for a couple days at a time, and they offer classes throughout the year. And so once you finally get it all done, it takes almost a year to complete. And at that point, I was still in general practice, and I still see tons of geriatric patients, and I got all these dogs and throwing all these drugs at them, and nothing's working. And I'm just like, I need to have another tool in my belt. And when I was in vet school, I actually, in my senior year, I actually learned acupuncture. And back then, this is almost 15 years ago, acupuncture was still new to veterinary medicine. And so I was already interested in alternative and complementary type medicine, and I didn't really use my acupuncture very much in general practice. And then I was just like, I really need to just do this more. Like I need to give people more than just, hey, here's some more drugs. So that's kind of how it really came about, is like, I wanted to do more of the alternative complementary medicine, just because when you're throwing all these drugs at them and nothing's working, it's what do you do next?
Mm-hmm.
And so I ran into that with my own dog. It's like when she developed kidney disease and then eventually she developed cancer, it's like, there's only so many things you can do. And you have to find other ways to help them. And some of it is palliative and some of it is just simply strengthening and just that mobility. Like, I got to keep my dog moving. So that's kind of how a roundabout way of how that actually came about. So
that's awesome. At what point did you found ACE of Paws? That's in Albuquerque, correct?
It is. So ACE of Paws started officially in September of 2019. So we've officially made it to 3 years.
Yay.
And all the way through COVID, and COVID nearly wiped us out. We had to basically, we'd only been open maybe 6 months, maybe right before COVID started. And so we pretty much lost all of our clientele because of COVID, the shutdown and everything. And because we were working with geriatrics, a good portion of them passed away during that time. And we took a good 6 weeks off. During that time, I was still working as a general practitioner. So I was still working full time and transitioning into my own business. And so I was doing both of them part-time. And slowly, we've gotten to a point now where we're open a full schedule. We're open 4 days a week and we're seeing patients all the time. And it's grown immensely over, and a lot of it is just, our referring veterinarians, our word of mouth, like, it's just slowly building the practice.
It's so needed. It's always been needed, but I know that especially in the Albuquerque and Santa Fe area, to have a standalone rehab therapy practice is like, you are such a gift to these animals in the area. And
I got to ask, you must have gotten the treadmill. What suite of services does ACE of Paws offer?
So I try to offer a very wide variety of things because, there's some things out there that people are starting to, or I should say veterinarians are starting to offer that are, in the complementary realm. There's certainly more acupuncture now than there was in the past. I've got colleagues that have gone and done the same training that I did, and they offer that. A lot of places are starting to offer laser therapy as well, which laser is one of the things that I use on pretty much every dog I see. Acupuncture I use quite a bit for the neuro and definitely orthopedic type cases, but I definitely like it for my neuro dogs, my back dogs. We're trying to get these paralyzed dogs back up and walking. So those are kind of the ones that you can find. It's not necessarily rehab specific. Because I am a rehab only clinic, we offer things like the PEMF, which is pulse electromagnetic field. So that in the form of like an ACE loop or a bed while they're getting treatment. Obviously the laser therapy. Sometimes we do manual therapy, just depending, and my technicians are trained in massage. So some of that is joint manipulation, which is me, whereas massage is more them. Obviously, the underwater treadmill is a great tool for a lot of dogs. You don't always need it. There's definitely a lot of practices out there that don't have a treadmill. And you can certainly do rehab without it, but it's a really awesome tool to have, especially when you're trying to teach them how to walk again or, just simply fitness, fat camp. you're trying to get these guys to lose weight and they can't walk and, they're so sore and, it's a variety of things. Let's see what else. A therapeutic ultrasound. We use that a lot for dogs who have like shoulder issues, tendinopathies. We just got a shockwave machine. So, shockwave is really good for pain. Been using that a lot for our cruciate disease, hip dysplasia, all these dogs And those are especially important with our tripods because they like to develop arthritis. And a lot of them are, if they've got cancer, or if they've got some other concurrent disease, they're gonna develop arthritis so much faster.
Right.
Mm-hmm.
So yeah, I just got the Shockwave. Actually, I think it's been a couple months now. I think we're on like 6 months now, and I've been using it quite a bit. It's a new tool to the practice, but we have a wide variety of things.
Well, it sounds like you do it all, and we know that all cases are different, but we're particularly interested in tripods. So, Renee, you had some questions about that.
I like to tell people rehab when their dog loses a leg, or even if they adopt an older tripod. Why is rehab therapy beneficial for tripods, in your opinion? What can it do for them?
So, it kind of depends on, like you said, where you find them. If they're a brand new tripod, and if you're lucky enough to have a clinic that, is kind of a surgery center, and they might have a little, rehab department, and their rehab department might only be a room that has a treadmill in it and a little exercise floor or whatever, they still can do some stuff. In that immediate post-op period, they can implement therapy right away. So, and that could be in the form of, icing or doing cold compression right immediately after surgery. If they do have a laser, they can laser that incision site. They can do things like TENS therapy for muscle relaxation.
That's that little machine with the sticky
electrodes.
Pads.
The electrodes. Okay. So like, if you go to the chiropractor, a lot of times they'll throw those on you, and it helps relax your muscles, and, feels a little tingly and feels really good. So you can't do that with dogs. You have to shave them a little bit, but yeah, you can do that with them. You can start range of motion, so they can get them, started right away, essentially. So, if you've got a practice that, offers those types of therapies, obviously just, it's kind of that general nursing care. You can essentially start day one. Where I typically see them, because I'm a rehab only practice, I don't usually see them until about 2 to 3 weeks later, after they've already had their recheck with the surgeon. They've had their sutures removed and all that. And the surgeon said, okay, everything looks good. You guys can go on your way. And, they usually give them some generic, like, oh yeah, just, start walking a little bit, get them up and moving, maybe do some range of motion. They don't really know what to tell them to do. Mm-hmm. And so I get in there and give them this is what we're doing. This is the program we're going to follow. This is how we're going to get your dog working better.
So you said something important there that Renee has a note about, and we hear it so many times where there's still so many vets out there that say, they'll be fine, just go let them be a dog. So right. Why do you think that is? Are these vets not...
I mean, is it just that they don't get trained in it in school, so they just don't ever think about it? Or it just seems...
Well, I never learned it. I mean, I've been in this field almost 20 years, mm-hmm. and I didn't hear about rehab or really know about it till 6 years ago.
Wow.
And now you've got schools that are actually, doing it as a rotation. They're teaching it in their program. So, Colorado State has it. Obviously, some of these other schools are finally starting to develop an actual rehab program, and they're working with certified therapists that are, running their program for them. And the therapists aren't always veterinarians. Sometimes they are human PTs that have gone and gotten certified. And so that's also in the realm of, we're getting the word out, that more people are learning that this exists. And I have that problem in my practice is I have so many clients that come and say, I had no idea rehab was a thing. And certainly the veterinarians, they might have heard about it, but they don't understand the value of it for their patients. And so, when we first opened, we had to go around to every single clinic in town and be like, hey, wow, we're in town. We have these services. Send us your clients. We can help them. Mm-hmm. You don't have to say, oh, my dog is 10 years old and here's some drugs and I don't know what else to do for you.
It's nice because you've been there, what that's like, not to be able to offer anything else to the animal. And now that you can, I mean, I'm sure veterinarians really pay attention when you talk because you've been in their shoes. So now you can answer these questions they have about why can't I do anything else for these animals. I think it's awesome. We lucked out that we heard about acupuncture in 2007 when our dog got he was a tripod and he blew out his cruciate, and we met somebody in Durango, Colorado, and she was an acupuncturist, and it just opened our eyes, and we thought, wow, this is just the beginning. So it's nice to see how far it's evolving, and that now, vet students are getting exposed to it. So when it comes to tripods, how soon do you like to see them? Because like you said, some are lucky enough to have their surgery done at a practice that offers even a little bit of rehab. But what's the ideal time frame that somebody should go see a therapist?
I try and see them right away.
Okay.
I mean, as soon as possible. So, if they're a new client, like I said, right after surgery, we try to get them in that 2 or 3 week post-op period if we can. If they're contacting us and they're saying, hey, my dog just had surgery and, I want to know what I can do. We try to get them in after that 2 week recheck with their surgeon and have gotten the okay. If they are a client already, and it might be, they just got diagnosed with cancer or, what have you, or they broke their leg and it's something irreparable that, we already have that established relationship with them. We may do, some prehab, and then, we'll see them even the week after surgery and just do some of that nursing care, trying to get them up, trying to get that swelling down, trying to do things to help heal that wound as fast as possible and get them up and moving.
Wound healing is a part of therapy too, right? Mm-hmm. I mean, that's even that incision needs some kind of extra TLC.
Yeah, absolutely. And, we don't want to develop a lot of swelling in that area. We want to increase the circulation to that area. And, even just simple massage and things like that and icing can definitely bring that swelling down. We want to watch for infection or dehiscence of that incision site that, that just puts us behind, and it's extra stress on the body and things like that. So, it's nice to have professionals who are, when the owner doesn't recognize that there's a problem and we're like, hey, there's a little drainage here, or there's a little spot here, or this is really hot. Like there's something going on underneath the surface. So it's nice to have, even just a technician who can recognize it, this doesn't look right, or, maybe it's a little stinky,
or they don't know how to identify pain. We hear it all the time when people say, oh, he's not in any pain, but he sits down on his walk. Yeah. Or, he keeps scooting along, but he's not in any pain.
So What are your thoughts on that?
I hear it all the time. Oh, he's limping, but he's not painful.
Right.
I'm like, I don't understand the disconnect here. Like, if you sprained your ankle, you're limping, you hurt, right. You're in pain. And yeah, I fight with a lot of clients on that it's, your dog is not going to scream. Your dog is not going to cry unless maybe he's a little Chihuahua or some, little, one of the little toy breeds, they're a little more dramatic. But your German Shepherd, your Golden Retriever, your Labrador, like they're just going to lay there and act like they're fine because they're so stoic. They don't, they're going to play through the pain. And, I think a lot of times, and like I said, I deal with a lot of geriatrics, that the slowing down that people say, oh, well, he's just getting old, he's slowing down. That's underdiagnosed arthritis. That they don't recognize that as pain, as mobility.
Right.
And we lose so many of those older, big dogs that should be mobile when they're 10, 12, 14, because they didn't recognize it early enough.
There's a reason they're slowing down.
Yes, absolutely. And, and I get a lot of people who are like, well, I don't want to give him pain medication for the rest of his life. I'm so scared of pain medication. And, definitely in the human world, we have a problem with opioids. There's a lot of stigma around that pain medication is bad. And we have to kind of rework it in our brain that, not all pain medication is bad. And I know I have chronic pain issues, and I had an orthopedic guy tell me, you need to go do yoga, you need to go get acupuncture, you need to go do these things, you need to get healthier so that you don't have to take pain medication. And I flat out told him, like, I don't want to take opioids. Like, I don't want your drugs. Like, I just want to know how to fix myself. And I was very happy that he wasn't a pill pusher and said, here, take these drugs. Like, he actually was like, hey, go do something better with your body. And I feel like, I get a lot of people that they wait too long, like they just, and there is an appropriate time for pain medication. Absolutely. Which, if your dog is painful, it's limping, you need to get that inflammation under control. You need to get that pain under control, because your dog isn't going to move. And you get stuck in this vicious pain cycle where they're not moving, they get more stiff, they get more painful, and it just keeps going back around and around and around, and you get stuck in this chronic pain loop. And pain medication has a place, but we can also combine that with laser and acupuncture and some of these other things and strengthen those muscles, because there's weakness there, or there's a trigger point there, or there's something there that's preventing us from correcting that pain. So you got to get these guys moving. You got to get them up and moving. And pain medication, is great, but I want to use the smallest dose possible that keeps them going. And you got to get them to a maintenance where they might have a bad day and they might need a pain pill, but for the most part, they're comfortable all the time.
Mm-hmm.
That's the goal.
Everything you say just rings so true. And we do see a lot of new tripod parents who are very reluctant to continue pain medication of any sort. And when you meet with somebody and they talk to you for the first time, what can they expect? Are they going to have to keep the dog on pain medication, or will there be a time when they can decrease it because they're adding in other things? How does your general experience with a new tripod work when you start seeing them?
Yeah, typically they're going to still be on pain medication. Like I said, in most cases, if they're immediately post-op. Some of them, when I see them, if it's a month or two later, they might not be on meds. And part of my evaluation, what I'm looking for is, are they, do they have pain somewhere, in their stifle? Do they have pain in their hip? Do they have pain in their elbow? And a lot of times, especially starting out, if they've never really done anything more than just walking, we will often put them back on pain medication, or tell them, hey, give them a pain pill right after a session, because they're going to be sore.
Right.
It's just like us, you haven't been to the gym in 2 years because of COVID, and you go do 50 push-ups, and the next day you're going to feel that, and you're going to hurt, and you're going to say, why on earth did I do that? And so, I'll often tell them, give them a dose, that night. It'll help them be more comfortable. Certainly if it's a more active problem that I find on my exam, I'm going to say, let's do, a week or two and see how they do. And if they're doing better, then we slowly, wean it off. And the goal is to get it, like I said, to the lowest possible dose. It still keeps the dog moving, still keeps the dog comfortable. Young dogs are going to recover a whole lot faster, and they're going to be fine without pain medication. But my older dogs, they've got other stuff going on. They've got arthritis and these other joints that, unless you actually go and x-ray that dog, you may not find it. And they're just showing us kind of that subtle, like, I don't really want to move my knee that much, or I don't want to, my range of motion. And an owner's not going to recognize that. And that's where a therapist is a good helper in that, we're going to look at the whole dog. We're going to look at their muscles. We're going to look at their range of motion. We're going to look at how they're walking, because I can't tell you how many times they're sent to me for one problem and I find 3 more.
Wow.
That's why we're so passionate about rehab, especially for tripods. And we find ourselves faced with a challenge. I was just on Facebook earlier, and on social media, people say things like, oh, my tripod's now dragging the hind leg. I have an appointment with the vet. And I'm in a position where I often tend to say, skip the regular vet visit unless they're certified, take advantage of this program, go see a specialist. But what would be the one reason for someone to see the specialist versus, they love their vet. Great. Well, their vet's going to diagnose and prescribe an x-ray and that sort of thing, whereas the therapist can do what for them?
Yep. So when I was in school, basically it's, it was a lameness. Oh, he's hurting. 2 weeks of pain meds and put him on crate rest.
Mm-hmm.
Everybody's heard that. Try it for 2 weeks, see if it works. If not, come back. Sometimes they're doing x-rays that day. Sometimes they're not. Sometimes they wait 2 or 3 weeks. And in the meantime, that dog is just getting weaker and weaker and weaker. And that's what the difference in coming from general practice and coming into this is I've learned that that's so detrimental to these dogs that you can't always just throw them in a crate. And that there's even studies, I think, mentioned, from when I took this class, that, 2 or 3 weeks in a crate, you start to lose muscle. Like it doesn't take a lot of time with rest to lose muscle. And we got to be very careful. And obviously, like case by case, this is different. A different recommendation would be had if you're a neurologic patient. Neurologic patients are very different because they have to have that crate rest, that strict crate rest, because we don't want those dogs to become more paralyzed than they already are. If they're just on that edge and that disc is about to blow, we don't want them running around the yard. And so recommendation would be different for a neurologic patient. Like they might be in crate rest for 4 or 6 weeks, and it's literally you go potty, you come back inside, you go in your crate. Very different than a dog who just has an orthopedic issue. And, it's more about like, okay, well, you got to put him on a leash and maybe you only go walk for 5 minutes and, you go for your potty break and whatever, but we don't want him doing zoomies around the yard and we don't want him going up and downstairs and parkouring off the furniture and, but yes, they do need some restriction, but that whole, crate rest and 2 weeks of Remedil doesn't work for everybody. Mm-hmm. And I found that it's very detrimental to some of my patients. Certainly if they have a fracture or something like that, there's different scenarios, but we're just talking like in general.
And that's where the special training that the therapists get when they're getting certified comes into play versus, going and getting another x-ray and some more medication.
Right. Once you've evaluated somebody's dog, what does the program look like as far as length of time and how much of a commitment there is? I think a lot of people are scared that, they have this thought, well, is it going to be like a chiropractor?
All these expensive
Is somebody going to try to get me to go 3 times a week? Yada, da, da, da. I mean, what do you tend to do when you have a new patient on board?
Yeah. So, basically, I do my exam and, there's a couple things that happen during the exam. I'm looking at their gait. I'm doing measurements of their muscles. I have one of those fancy little stance analyzers that actually like tells me how much weight they're putting on each foot. So sometimes in those more subtle lamenesses, I'm like, I don't know what leg this is. And I'm having to sit there with my slow-mo on my video trying to figure out, like, are you limping on that leg? Are you limping on this leg? The analyzers helped a lot. I actually just got it here recently. And, definitely in the more subtle ones where I'm like, I don't know, is it really that leg? And, just kind of helps give me one more tool to see it. And sometimes it's just like, you start doing range of motion on a joint and you're like, oh, there's a pop, there's a click there, or, oh, you don't bend this leg as well as you bend that leg. So, I look at the whole dog and, oftentimes, like I said, I'll find, it's like, oh, he just had an FHO and, he's not really extending that hip, but then there's something going on in the front leg. That's the opposite front leg. Because now he's putting all the weight up there. So now his wrist is ouchy, his elbow is ouchy, his shoulder's ouchy, something else is going on. So, I look at the whole dog. I come up with a plan. I'm like, and I write out a list for the owner. I'm like, these are the things I see, and these are my goals for your dog. So whether it be we're going to increase weight bearing, almost everybody, we're going to address pain because everybody has pain. Mm-hmm. We might be working on your flexibility. We might be working on your strength. Everybody needs core. All of us need core, especially tripods. They need core work all the time. So when I come up with a plan, I sit down with the owner and I just have a general discussion with them about like, this is what I saw. this is what I plan to do. These are the therapies that I recommend. Kind of set out a treatment plan for them. And I'm going to give you homework. And your homework are these exercises, and you got to do them every day, especially starting out. And so, I try to put some of the responsibility on the owner too. They have to be a participant in their care. They have to be an advocate for their dog. So I need them to be my partner. And, I need you to do your homework. And when you show up every week, you can't lie to me and tell me that, oh yeah, I did it every day when I know your dog isn't doing it, because I can see it, because your dog's not getting better. You can't lie. Your dog tells me,
So it's an equal partnership. I mean, the pet parent is just as involved as the dog and you. Yeah. It's like, I mean, it sounds like that's the only way it's going to work.
Yeah. And then you have to come up with ways, because some dogs aren't treat motivated. Sometimes they're owner motivated. And so, sometimes we have to have the owner there to get the dog to walk in the treadmill. Sometimes we have to have the dog, the owner has to lead them across an obstacle or something like that, because the dog is just like, screw you, I'm not doing this. Like, I'm just going to sit here. So, it just kind of depends. We really like the food motivated dogs because they're easy to work with. But, we've got some dogs that do really great with their owners. And then we have other dogs that it's like, yeah, can you wait in the lobby because your dog is trying to eat me because he wants to protect you. So
we
understand.
you gotta figure it out. I mean, I have some truly aggressive dogs that come into my practice that they come in with a basket muzzle, and we just try to figure out what their triggers are. And even if the dog is aggressive, there are workarounds and there are fear-free ways to do things with them too. And you just got to know what their trigger is, you got to work around it. But point is, I come up with a plan, and I set it out for them. I have a discussion with them, and, basically, it's asking for the owner to commit to, initially like a tripod. We usually do like a week long or a week, an appointment a week is what I'm trying to get at. So like we'll say at least come in once a week, and we do that for 6 to 8 weeks, 8 to 12 weeks. It kind of just depends on what I see. And that's kind of my general recommendation for pretty much anybody, because I want them to get used to coming. I want them to understand that, we're not the regular vet. If their dog's really nervous, like it might take us 2 or 3 tries before they even get in the treadmill, before we even turn on the water, before they even start walking. We try to do it as positive reinforcement. And so, getting the dog used to all these new things and getting them to be comfortable coming into our practice so that when they come see us, they're excited to come see us and it's not scary. And so we get that commitment from them, like, hey, we want you to come every week for, 2 months. And then after that, I do a reevaluation. And I take a look, and I basically do a kind of abbreviated version of my initial exam. So it's a little shorter exam. I'm basically just rechecking the things that I'm like, that leg was a little less flexible, or I want to see that the muscles are improved on this side, or, if they've got atrophy on one side, I want to see that they're actually evening out on both sides. And how are they standing? Are they walking better? Are they lame still? Are they, or do I not see the lameness at all? So after that follow-up, then I adjust, and most of my patients, unless they're really young dogs, we might see them periodically, if they have, it's basically, we say we graduate from therapy, come see us when you need us again. When they have a new injury or a flare up of whatever, the injury is, I try to give them the option to, if possible, to go to more of a maintenance. And I think of these dogs, especially the older dogs, as a long-term project. Mm-hmm. That we need to get these dogs to a maintenance. And every dog is different. So some dogs, especially at end of life, it's more like we might get to every other week or, even monthly. And then we kind of go back to every week once the winter hits or something, they're having a flare up. My kind of middle-aged adults to younger adults, they might be coming twice a month. They might be coming once a month. They might only come see us if they think like, oh, hey, he's not moving as well. And we might deal with that flare up for a couple weeks, get them back to where they were, and then we let them go again. So it kind of varies on the pet and what's going on. But these guys, especially tripods, they're a forever client.
But it does, I presume the goal is to help get the animal to the point where it doesn't need such intensive therapies regularly. So there's going to be an extensive period, it's a more intensive period at first, and then they're going to get into that maintenance mode, like you said.
Correct.
Having raised a tripod from, we got Wyatt at 8 months, and he lived to 12 years. We saw the changes over time. And when he was a young puppy, he was just a go-getter. And of course, he tried to do everything that other dogs did. So we found that having an ongoing relationship with a therapist like you was so beneficial throughout his life. And that's a huge reason why we have the Tripawds Foundation Rehab Reimbursement Program, is because we want people to know that there are therapists like you out there, and especially vet therapists are like the gold standard. You were like
right.
top of the list there, because you have both sides of medicine with you. Now, if somebody doesn't have access to a really awesome therapy center like yours, what are their options?
Right. So I live in New Mexico. It's very rural, and definitely therapists are few and far between. Like you said, there's a practice in Santa Fe, there's my practice in Albequerque, and there's a practice in Las Cruces, and that's pretty much it for the whole state. And I will occasionally get clients that will drive 2 hours to come see me from Arizona, from the southern half of the state. I've had, I think somebody come from like El Paso, that nobody's near them. So, they turn it into a day trip kind of thing. And what I try to do for those people is give them a plan, right? Like, this is the plan I want you to stick to, whether I can see your dog or not. And obviously, there's some things that you can do at home, and there's things that I can do here. Like, everybody doesn't have an underwater treadmill in their home. So, how can you modify things to just, at least do the basics? And a lot of that is more the exercises than anything. And just being able to recognize, like, hey, when do you really need to go, see your vet? And when is it a problem for your particular case? So I do have people that travel to see me, even just for the one time, and, try to basically set them on a path. There are resources out there. Obviously, you guys do a great job of advocating for tripods, and, you guys provide some of that. There's YouTube videos. There's online Facebook groups that, are, dogs living with disabilities kind of thing. Like, there's a lot of different resources out there that you can find for, examples of how to do a specific thing. But, it's kind of general information. Depending on where you live, in New Mexico, we're not allowed to do telemedicine, but there are some states where you are allowed to do that. So, you could go and see a therapist and establish a relationship with them. And then, if you are in a remote area, you could hopefully do something telemedicine. And we're seeing that more and more in vet medicine anyway, but it really is state dependent. Like, we're not allowed to do any kind of telemedicine type of things in the state of New Mexico.
But it sounds like it's really beneficial to get that first hands-on evaluation, because every dog is different. And then even if it's just that one evaluation and a lesson plan and then some periodic follow-ups, what would someone look for in a clinic, a rehab specific clinic, aside from the credentials? Like, well, how do you choose if you're lucky enough to have choices?
Yeah. So definitely finding a certified therapist would be ideal. If you can find somebody, and there's little search engines on those programs that say, find a therapist and put your state in, and hopefully you can find somebody who is certified. I do know there are some general practitioners out there that have gone to, CE meetings and things like that. And they do have lectures that are very general that they're just, here's how to start a rehab program in your practice. So there are some general rehab, or I should say some general veterinarians that do have a little bit of rehab knowledge, and can touch on it. But I would hope that, your general practitioner who has no idea would say, hey, I don't know, or let me find you somebody you could talk to, or, they can use their network and say, hey, I have a colleague who actually does that in Colorado. I get we get a lot of those on like our listservs, like, hey, my client's moving to somewhere, anybody doing a practice in that area. So, I would hope that your general veterinarian would be like, I don't know, but let me find out. Let me find you somebody who can help you or point you in the right direction.
And if not, call the Tripawds helpline at 1-844 Tripod, or go to the resources page. We have those search engines at tripawds.com to find, certified practitioners, and all those links will be in the show notes.
Yeah. Thank you so much. This has been so helpful. We really, really appreciate all of your knowledge.
Yeah, I'm happy to help. And if you guys want to do a different topic, let me know.
We might take you up on that.
Bet. Be careful. But thank you so much, Dr. Esquivel. It's been great fun, and we hope to have you on again soon.
All right, sounds good. Thank you.
3 paws up to Dr. Esquivel for the work she's doing. Learn more about her Canine Rehab Clinic at aceofpaws.com. See how you can get a free rehab consultation for your 3-legged dog or cat at tripawds.org/rehab.
He's a 3-legged dog and he's still pretty good.
Thank you for tuning in. Subscribe to Tripawd Talk Radio for more pet amputation tips from experts, and claim your free gift just for listeners at downloads.tripawds.com/podcast.